All right, it's buffering. We should be live in a little.
Hello, everyone. Welcome to Mind, Body, and Spirit, another Facebook Live series from Debbie's Dream Foundation. My name is Dr. Salome Bozorgzadeh. I'm a clinical psychologist and the current president of the Sufi Psychology Association. Today, I'm going to be talking to you about how to cope with trauma and burnout. And a little bit about me, I'm a psychologist here in Chicago. I run a wellness center and a group practice. I have been working with health caregivers for a couple of years now, helping them with burnout, and have been working here with both the caregivers at the hospital as well as the oncology patients here to cope and to get some relief. In addition, I do a lot of my practice is in Sufi psychology. Sufi psychology is using the teachings of Sufism, which is a practice in self-knowledge, a discipline in self-knowledge, utilizing those in modern day psychology. So basically, not just looking at symptomology, but going to the root of who each person is so that they can discover all the strength and capabilities that they have within. So thank you for having me. I'm very excited to be here with you today. And let's go ahead and get started. First of all, these are the wonderful sponsors of this event today. So I know Debbie's Dream is very excited about them. Okay. So right now is, I know, a difficult time for everybody, whether you are a patient or a caregiver at this time. There's a lot that comes with this diagnosis. There are changes, both in terms of your body changing, not responding the way it used to, also your relationships changing, your mood, your energy levels. There are so many changes. And for the caregiver also, your relationship with each other changes. How you also deal in your life is shifting as well. So there's a lot going on to just that you're trying to get your footing as things are happening. There are fears that come up at this point. There's grief. There's hopelessness. For some people, there's shame. Our brains have a really interesting way of turning something that absolutely is not our fault into somehow being our fault or our doing. It's really incredible how it does that. So sometimes there's that. There's anxiety, shock, or a numbness at times. Some people also during this time feel dissociation. And what that basically means is it feels like you're watching your life and not necessarily engaging. And again, all of these are for both the patients and the caregivers that a lot of times we feel these ways. I'm sure there's more things that you all would feel. There's also just pain and discomfort. the social challenges of being around people, dealing with questions, having to answer, having to talk to people. And then there's obsessive thoughts, right? When you're going through something as large and as life altering as this, you can't help but have it be the forefront of your mind constantly. So this is essentially a lot of the things that are going through, and these are all normal, right? So all of these components are absolutely normal reactions. And the reason I'm really emphasizing that is because a lot of times we feel pressure to not feel these things. There's a lot of verbiage of you must be positive, stay positive, be positive, be positive. And that sometimes ends up putting more stress on us. Like now we feel like we're not doing something right if we're feeling these things. These are normal things that you have to feel. And it's okay to feel them, and you can't fight them. The more you fight them, you actually end up causing more issues. And we'll talk about that a little bit down the line. Okay. So the most important thing during this time is to remember to be kind and gentle with yourself. This is imperative, both as a caregiver who is a little burnt out and as a patient who's going through a lot of changes. Is you need to be kind and gentle, give yourself space to have emotions, to be irritable, to not feel good, to not be yourself. This is all normal, and just give yourself that space for that. Okay. So for patients, these are a lot of times the things we hear. This is great advice. We're told to use your supports. Sometimes patients report feeling that they feel guilty. They feel like they're a burden on others. But keep in mind that this is what we're here for. We are here for each other. This is what we do. We take care of each other. When someone is feeling more vulnerable, the rest of us step up. So this isn't a burdensome thing. This is a human interaction thing. This is how we interact with one another. Seek therapy. It's okay to talk to others, to give yourself another person to speak to instead of just your caregiver, so that they also have time for themselves. You have someone that, you might actually be feeling frustrated with your caregiver, right? That dynamic gets a lot of pressure. That relationship, the caregiver-patient relationship, there's a lot of pressure that gets placed on it during this time. So it's okay if you guys are annoyed and frustrated with one another. So having a therapist or someone you can speak to outside of this dynamic is really helpful. Nowadays, you don't have to even go anywhere. It could be online. So I would really recommend that. So there's a lot of nuance with what you're feeling. And so having someone to work through it with is really helpful. The most important thing is also to give yourself permission to feel. It's okay if you're feeling sad, if you're feeling angry, if you're feeling vulnerable or confused. All of those things are absolutely normal. And the important thing is to feel them. So one of the things that happens oftentimes is when we're feeling, let's say we're feeling sadness, and then we begin to get mad at ourselves for feeling that way. Well, I shouldn't feel this way. I should be more positive. I have all these positive things going on in my life. Why am I feeling this way, right? All of that we end up putting on ourselves, what that actually ends up doing is it multiplies and maximizes the problem. So now what was just a normal sad feeling is now sadness on top of guilt and shame, right? So the problem has now multiplied. So and all of that makes it really challenging to kind of move forward. So it's okay to be sad. And you can be sad. You can be sad, but still do what you need to do. You can just be sad. It's okay if you're angry and irritable. That's the other thing that oftentimes I feel that people feel guilty for being, is they feel guilty for being angry, irritable, cranky, moody, snapping at people. That's okay. Right now, there's so many factors happening that oftentimes it kind of gets out of our control. So to be a perfect specimen with incredible temperament is really asking a lot of anybody, much less somebody who is going through the challenges in this difficult time right now. And then the other thing is, look, at this point, I'm assuming for patients, you are doing all that you are supposed to be doing. You are doing your treatments, you are maintaining the regimen, the medication, the nutrition, sleep, diet, hygiene, all the things that you're supposed to, you're sticking to, right? If you have any energy left, We don't need to spend it, if possible, on thinking about more of this, right? So if we could start bringing in things that bring you joy, at least it gives your mind a break and it gives your body a break. So if you can, now I understand that there's some times that we are so low energy and so deep into what we're feeling that it's hard to even do this. But if we can start to bring little things that bring us joy, whether it's being around a family member, a child, that just makes us smile, or watching something that typically would bring us, like make us chuckle, reading a book, any form of spiritual practice that brings us joy, volunteering to whatever capacity you can. Sometimes you can, sometimes you can't, depending on where you're at. But that's really important, is to somehow try to bring some level of joy. Maybe it's cooking for others. Maybe that makes you happy. Now, you have to also be mindful that your energy levels and things might not be the same, but that's okay. Doing whatever you can within the constraints of where you're at, but trying to bring some level of joy and lightness to your situation. Again, keeping in mind that you're trying to be kind and gentle with yourself, right? Stop the pressures. And by that means, a lot of times what I hear from patients is this underlying pressure to be a certain way, to act a certain way, to feel a certain way. You don't need any of that pressure at this point. Right? At this point, you're being kind and gentle, giving your body some time to fight and heal and do whatever it needs to, while you are just supporting it and giving yourself some I guess, avenues to find joy or laughter or fun, if possible. So bringing some positivity, some lightness into your life as much as possible, right? And then the most important thing is to remember that you are more than your body. Oftentimes, we just think we are our bodies. So if our bodies are in pain and our bodies are struggling, we also feel pain and struggling, which we should. This is part of us. But if there's a moment that you can at some point tap into something that feels deeper within, that it feels like there's more to you than your body. It doesn't mean the pain goes away. It doesn't mean you're not feeling that. But at least you begin to create some separation between your experience and what's happening at the physical level. And that gives a little bit of relief, right? So a lot of times we use this in like narrative psychology. You create the challenge, the disorder, the difficulty is something that is separate from you. It is not you. And so what you can do at that point is then you can kind of turn inward a little bit and you can talk to yourself. You feel a little bit of separation, a gap, to give yourself a moment to breathe between you and your body. Your body's going through a lot. That includes your mind. Your brain is going through a lot. It's saying a lot of things. It's saying all sorts of things. It's got a lot of fears that it's coming. These are all natural. But then there's a part of you that is separate from this, right? It's the part of you that has hope, that pushes on, that's been there always. So sometimes we rely on that. For some people who are more spiritual or religious, they might call that their soul. They might lean into that. For others who that isn't part of their belief system, it just might be a spark within. It might be that point of themselves that gives them hope and strength. Okay. For caregivers, now burnout is a real thing. It's not just something we say, oh, I'm burned out. That's what we do in society. But in reality, burnout is something that actually physically strains you and mentally strains you. So with burnout, it begins with just slight irritability. You might just start getting annoyed and short with people. And then it begins to manifest and affecting your sleep. You might find that what you were passionate about before, or that care you've shown before, you feel a little numb or cold towards people, right? This is as it's progressing. So burnout actually is a psychological and a physical thing that happens within the body. And so the more this happens and the more this progresses, then it results in challenges with eating and sleeping. And then down the line, it could even result in affecting your immune system. When we are in a state of heightened stress, it does decrease our immune system's ability to fight and to repair. So it's legitimately a thing with burnout, and taking care of others is a thing that oftentimes does cause burnout, especially because there's so much pressure on us, so much pressure we put on ourselves, but maybe others put on us as well. So some things that you have to incorporate as a caregiver: you have to take some time for yourself. Oftentimes that's something we feel we don't have. It's just not an option. Even if it's 5 minutes in the shower, that you actively kind of separate yourself out from the world and just and check in with yourself and see how you're doing. Fine. If it's longer, that would be even better. Going for a walk, a 30-minute walk, to be in nature. Basically, this time for yourself is for you to check in and to tap into yourself. The other thing is to seek support. Again, with caregivers, it's important for you to have someone that you can also talk to and to process this with, and everything you're going through. A lot of times what I hear from caregivers in my practice is they feel that they're not allowed to, like, I'm not the one that's going through this. So almost like their experience is minimized. But it is a legitimate experience. You're going through a lot. It's a lot of pressure. It's a lot of, you have your own grieving and emotions that you really don't have time to even process or go through because you're trying to be strong and be there for someone else. That's a lot. So it's important to have your own support system. I'll tell you one thing that we have done here at my practice, and I'm sure other practices as well, is you can have it set up where if they have multiple clinicians, where your appointments at the same time. So it's not like you have to spend that much time away from each other either, away from the patient and the caregiver. So, the patient will be seeing their therapist at the same time that the caregiver is seeing their therapist. So it adds for a nice way also if there's time constraints. So I'm sure that there are places that do that and allow for that. So self-care is a really important piece. We talk about self-care. Everyone talks about self-care very easily. Now, self-care is not getting a massage or getting your nails done. That might be part of your self-care, but that's not what that means. What self-care means is to first take an inventory. So first take a look at where you're at. How am I doing in these different aspects of my life? How am I tending to myself physically? How am I doing emotionally? How am I doing mentally? How am I doing in terms of work or my responsibilities at home? How am I doing in terms of my spirituality? Right? You look at these different aspects and you see, where am I neglecting? Where is getting strained because I'm putting more energy over here, right? And that's how you determine what your self-care is. Self-care is balancing this all out. So if I go and I get a massage because I'm supposed to, but part of the thing is, I feel out of balance because I haven't washed the dishes in over a week, right? That massage isn't giving me any self-care. I'm going to come home even more stressed to this I have to deal with, right? So it's important to self-care really means taking a look at what aspects of your life you need to balance and then incorporating that piece in. So I hope that explains the important piece of self-care. Self-care isn't just, okay, go do this. It doesn't always feel good. Again, for caregivers, allow yourself to have emotions. You're going to be irritable sometimes. You're going to be sad. You're going to be all sorts of things, and that's okay. You have those, you're allowed, you're human, they're normal. And as we just talked about earlier, the more you ignore those things, the more we end up causing more issues and damage. Okay. And as we talked about earlier, don't minimize your experience. So the stages of grief, both patients and caregivers will be going through these stages, and this is something to keep in mind. The first stage is typically denial. This is when you kind of don't believe it. You don't really think it's happening. No, not really. Some people are, this also is on a spectrum, right? It could range from being completely in denial, like this isn't happening, this is a mistake, to not really feeling it and kind of going about your life like it's no big deal, right? This is typically the first stage of grief. This is also the stages, they say, of a diagnosis. Now, keep in mind that these are not linear. They could move around. You might start with denial, go down to bargaining, come back up to anger, go back to denial, right? But these would be the typical stages in terms of progressing, is that you'd be in denial. The next stage is anger. Now, anger is also irritability, frustration. So that's the next phase, is you feel that way. You feel kind of cranky towards everything. Totally normal. I mean, how could you feel anything else? This is absolutely appropriate given the circumstance. And then it's the stage of bargaining. Now, bargaining, sometimes it's with a higher power in the sense of, I will never do this if you do this. And sometimes it's something that's a little bit more subtle, of bargaining of, I'm going to do this from now on, and this is going to fix it. I'm going to do this from now on, and this is going to fix it. Just things in your life that you're going to shift around in the hopes that there's going to be some kind of reward given if you do this. So as you see with bargaining, now hope is kind of coming out, and there's hope, and the hope is saying, hold on, there might be something here. We can do something. We can do something. And then there's sadness. And this is where we feel depressed. It's all sinking in. The grief is sinking in, what we're understanding and hearing is sinking in. And so it's natural to be sad. And then typically the final stage of grief is acceptance. So it's here where we finally kind of get to a place where we can accept the situation. Now, keep in mind, that does not mean that you're supposed to be happy-go-lucky and everything's all as well. You still are going to have emotions. You're a human being, and you're still going to have the ups and downs, and you might even flip back into anger or bargaining or sadness, and that's okay. But typically these are the stages and the ways we move through this. So again, any of these and all of these are completely normal. So I wanted to talk about a couple of things that happen both with burnout as well as a patient and with trauma. So typically when we're doing work with trauma, I should say this on the side, typically when we're doing work with trauma, we try to give trauma a meaning, right? We try to place this traumatic event that has occurred to, for it to somehow make sense within the construct of your life. So whether it's, okay, this has happened and now this makes me now do X, Y, and Z, live this way, live that way. It makes me think of things a little differently, whatever it is, but we try to give it so it's not just this thing that is out there that is affecting us that really makes no sense whatsoever and serves no purpose. If we can give it some level of purpose, it helps us cognitively process through it. Now, in a situation of a diagnosis, it's a little harder to do that, right? It's harder to say, oh yeah, there's a reason for this and this. Although in the movies, they will do that. They will, it seems like it's actually easy to do. So at this point with trauma, in this stage, it's not easy to give it a meaning, and you can't. So sometimes the next thing is just to give meaning to the rest of the aspects of your life, so that there's so much meaning and experiences that are happening and that are fruitful, that then this piece doesn't need its own definition and meaning, if that makes any sense. But there's times when you have no energy. And these are the times that are really, I think, scary for a lot of patients. And what I mean by no energy or no care, there's times when our bodies are going through changes and it's weak. And one of the things we don't know is when it's weak like this, we don't actually care. We lose care for everything because we don't have the ability. The things that we may have really loved before don't really matter that much to us. You might find that you don't even care about your loved ones in some moments, or your spiritual practices, religious practices, you don't even care about those. Right. And these are things that when we kind of see it in ourselves, it could be very frightening. It's like, what's happening to me? Oh my gosh, am I getting numb? Am I depressed? Why am I feeling this way? Right. And it's because there's no energy there. So nothing else matters because you don't have the ability for anything to matter. All your energy is going into your body trying to maintain. So that's normal. And in these times, You can't really force yourself. Remember, we said no pressure. So instead, these are the times where we need a little bit of support from the outside. These are usually not the times where we want people around. Typically, we just kind of want to be alone in these moments. But the support can be in the shape of, if there's playlists of music that have positive associations for you, something that reminds you of a happy time or was your favorite song, stuff like that. Have a playlist of those and you can play those. It's not going to change your mood or shift everything all of a sudden, but I'm going to explain why these things are important in a minute. Playing meditations or visualizations in the background, right? Just having something on. It's a guided visualization. It'll help redirect you. Okay. Reading or listening to spiritual or inspirational books, even if you're not feeling it. Again, just having this in the background, just hearing it, listening to it. And as you're going through this, to remind yourself that your body needs rest. Okay. And the reason I'm saying these things are important is one of the things that happens is how our brain works is typically our brain takes in everything it's exposed to, and then it just recycles them over and over and over again. So whenever I'm here and I'm feeling particularly, if I'm particularly weak, all my brain has to think about are the things it's been thinking about this far. And if it's particularly weak or stressed, it's going to be thinking about the default, what I call default thoughts. These are the old thoughts that are really ingrained, that we thought were out of here. We had tried really hard to work through and move through them. Thoughts about I'm a failure, thoughts about, I don't know, I'm unlovable, all sorts of negative thoughts that we've had from a long, long time ago. These are when they creep up. It's because we have such low energy that we don't have the ability to say, that's not accurate, that's not true. So it's these times when our brain has nothing to do, and it can possibly get into a little bit of trouble and kind of ruin our mood even more. So it's in these moments that we need to kind of put some positive stuff around. So at least our brain is hearing that. So our ears are hearing that. So at least it shifts us from the place where our mind usually goes, which is usually in more of a negative space, and at least gears it in a little bit more of a positive space, right? So that you're not putting that extra pressure on yourself psychologically now. And then there's times when our thoughts get the best of us, both for caregivers and patients. It's when we feel like we are, we're not doing well, we're having negative thoughts, we're feeling hopeless, we're feeling helpless. First, it's okay to allow yourself to have those for a moment, but we don't want to sink too deep into that. So the first thing is to disrupt the thinking process. How it works is when we start, and I'm sure you've all experienced this, when you start thinking, a lot of times we go down this rabbit hole of thoughts, and it's like cyclical, and all the negative thoughts keep coming up, and this leads to that, and that leads to that, and that leads to that. And before you know it, we're feeling incredibly sad and low. Or even thinking really negatively about ourselves in ways that we haven't in a long time, or that we don't actually think that way about ourselves. So first thing you want to do is to disrupt the thinking process. Anything that kind of cuts it off. Getting up, grabbing a glass of water, or feeling something cool, or feeling something that's got texture to it. So it forces you to focus on the texture of that as opposed to being in your head. Showers are really helpful for this. Showers have this incredibly calming effect, usually, if that's accessible to you, that is. But showers allow us to kind of wash away the thoughts, wash away the day. It's very peaceful and relaxing. So a shower is a really good way when you feel like you're stuck in your own head and stuck in your own experience, to just kind of give yourself a break, to disrupt that process that has gotten started. Journaling, for some people, they really enjoy journaling. Journaling has a lot of positive benefits, but just the act of writing down everything you're thinking, everything you're experiencing. And the key is, don't go back and read it, right? You write it, you close it, you don't look at it. It's just to empty out what you're experiencing, what's in your head. Meditation practices are really helpful. So meditation practices, now whether that's mindfulness, a yoga practice, Tamakos, whatever the form of meditation that you use, but typically what that does is it slows down, it teaches us to slow down the thinking process. So instead of going from thought to emotion really quickly, meditation helps us slow that process down. So then you'll have a thought, you can intervene, you can shift your emotion, you can shift your behavior. It also gives us awareness into what we're feeling and thinking. Sometimes we don't know why we're feeling something, we're feeling it, we don't know where it's coming from. And this gives us insight into our experience. The other thing is to remember that no two people are the same. I'm sure your physicians and doctors, everyone has told you no two people are the same. No two people's bodies are the same. So comparisons are moot. We can't really compare ourselves to others. So if you find that that's one of the things that's popping up in your mind and head is comparisons of stories you've heard or statistics, no two people are the same. All you could do is what you're doing. That's it. And then the rest we're going to have to surrender. And the rest we at least try to bring in, if we can, even a little bit of joy or peace. And the last thing would be to rely on the things that give you hope and inspiration. So if, for example, there are books, podcasts, stories, TV shows, music, sermons, those are the things you want, even if you're not feeling like it, just having it in the background, I think it would really help shift a little bit of the thought process that might be happening. And the reason that we're focusing so much on this, on thoughts, is because what you focus on gets magnified, right? Not physically magnified, but it gets magnified for you psychologically. So what we want to do is, in an effort to be kind and gentle, we want to give as much space and give as much grace to yourself and your body to go through this process. And for you to then, your job is to just be kind. And so what you can do is you can say, all right, these are the things that at this point aren't going to serve me, so I'm going to redirect. Okay. So again, the most important thing is be kind and gentle with yourself, both as the caregiver who's going through a lot and as the patient, right? And with both individuals, it's important to take that time for yourself. In those times is when you begin to check in with yourself, you begin to develop more of a sense of yourself. So someone has asked, how do I emotionally support my loved ones when I sometimes feel so helpless? And I think that this is a really good question. It's one that we hear quite often. And I think there's a difference. Sometimes to emotionally support people, we feel like we have to solve it for them or fix it for them, right? And this isn't something we fix. In these moments, I think sometimes it might even be sitting together in silence together, grieving together. It's just being there. It doesn't have to be something that you're doing to change them. Someone asked why I mentioned not to go back and read journals. Why do I recommend against this? Typically, years later, if you want to go back and read, that's okay. But a lot of times when we're journaling all the negative things out of our minds, by going back and reading, you actually end up putting yourself back in that state. Because it's still too close to home. So we don't want to do that. We just want to empty it out and then to leave it alone. And then, are there any books or programs that I could recommend to help de-stress? And actually, yes. I was going to do, and I think there's time, I was going to do a visualization with you guys that I think would help. So this is one form of meditation. So as I mentioned, there's mindfulness, there's yoga. This is called Tamakos, is this form of meditation. This is the form of practice I use here with oncology patients. A full Tamakos session actually includes multiple things. It includes mind relaxation, which is kind of mindfulness quieting of the mind. It includes deep breathing practices. It includes slow meditative movements called mobazine. It includes visualization and then a deep relaxation, which is getting rid of stressors of our body. Now, we're not going to be able to do all that. We're just going to maybe do some breathing and a visualization. I thought that would be a good way to perhaps end today. And then if there's any more questions, we could go from there. So, and if you more programs on IG at Tamakos app, there will be daily, there's videos of this, as well as there's an app and there's the website. So you can definitely get some resources there. Okay, so let's try something. We're gonna close our eyes, sit comfortably however you are, and go ahead and close your eyes. And begin to breathe deeply, inhaling through your nose and out through your mouth. And just give yourself some space and some time to quiet down, to let go of the day for a moment. Begin to focus on your chest as it rises and falls. Notice how peaceful that is, how calming that movement is. And begin to direct your breath into your mind. Or visualize your breath being a clear stream of water that as you direct it into your mind, it's clearing out any thoughts. And you breathe them out. Inhale through your nose, noting how cool and fresh the air is. Direct it into your mind, let it wash around, and exhale the stale thoughts. Exhale the warmth, the old lingering feelings. Direct your breath to the right side of your mind, clearing out all the folds, crevices, corners, any lingering thoughts. Breathe it out. Direct your breath to the left side of your mind. Breathing into that space and clearing out any thoughts, any emotions, anything that's lingering there from the past. Exhale, let it go. Allow your mind to feel open and light. And direct your attention to the back of your mind. Use your breath to clear out all the thoughts that are there. Breathe them out. Feel lighter. And direct your breath to the front of your mind, washing away everything in its path. Let go of any thoughts and emotions. Exhale and breathe it out. And with your next breath, direct it to the top of your mind. See if there are any folds and crevices where thoughts may be lingering. Wash it through, breathe them out, let them go. And with your next few breaths, just direct them through your entire mind, all parts. In case there's anything still lingering, any thoughts, any emotions, breathe them out, let them go. Notice how light, bright, and open your head feels. And drop down a little deeper into your center, into the center of your being, into your chest. See if you can breathe into that space. Notice how still it is. And just become aware that this stillness is with you. It's a calming point, a stillness, a place where you can retreat to when the things in the world are a little complicated and challenging. It gives you a little sanctuary so you can catch your breath and continue on. When you're ready, gently blink your eyes open. So I hope you enjoyed that. So that's an exercise of Tamakos. Tamakos it's a Sufi meditation, as we were just talking about. Its origin is in Sufism, which goes back to its practice in self-discovery and for each person to know themselves, the part of themselves that is strong, their creativity emerges, their strength emerges, that's eternal. That part, the part that even though as you've gone through life, everything has changed, that part has remained constant. It's the part of you being you that has never changed. So that's what the Tamakos practices are based in, the Sufi philosophy and the Sufi background. So that's what this is. That was one of the questions that was brought up. And the last question that we have is, how do we as caregivers deal and support our patient when there's bad news on a scan or a treatment? And I think in terms of how to support, the most important thing is to give room for grieving. Allow the patient to be sad, to grieve, and you can grieve with them, right? Grieving isn't necessarily, it's grieving is a process where you're letting go of an expectation that was there. Now, whether that expectation is depending on how bad it is or what it's, whether it's what you were hoping something was going to look like on a scan, or it's the implications of it for the future, right? So people are, let them have that time to grieve and allow them to grieve. And then just being comforting. So being there for them, not trying to fix it, but give them space. And in that way, I think that's the most comforting thing. People have an incredible resiliency. We have a resiliency and an adaptability. And that part of us who has hope and who wants to keep on will come through. But we just need to go through that period of grief first. So I hope this was helpful. So it's these types of practices that we just did that really helps clear our mind when we feel like this was a mind relaxation. It's one of the components of Tamakos. So this is one of the ways that it helps us kind of clear our mind and to basically be able to move through in a better way so that we don't feel bogged down and weighed down by what's going on in our head. There's enough going on in our bodies. So this is my contact information. If you have any questions or comments, please feel free to reach out. My name is Salome Bozorgzadeh, and this is the Sufi Psychology Association. So, and lastly, these are the sponsors again. So if there are no more questions, then thank you very much for joining me. I hope this was beneficial and provided some relief. And thank you for your questions. Have a good day.
That was awesome. Gonna end the live. That was awesome. Gonna end the live.